Now, I'm joined in here by the resident expert of the GameDay Men's Health in West Palm Beach, Wellington, and Delray. Dr. Matty Taha is here with me. Hello, and thank you for joining me today, doctor.
Hey, thanks for having me.
Now, when I first started doing hormone replacement therapy, I did it at the recommendation of my trainer. I was in my earlier 30s, and he was noticing that I wasn't putting on any lean muscle. We had been at it for about 18 months, and he just said, there's something going on. So I went, I did my lab work, I got my blood test, I saw that I had very low testosterone. I started the treatments, and it was unbelievable. It is the biggest thing I've ever done where I noticed a difference. In a couple of days, I was increasing my weight at just an alarming level. My energy was fantastic. I felt really good. But I only consider it to be something to put muscle on with. And then when I stopped lifting so heavily, I said, I don't need this anymore. My goal is to not have massive amounts of muscle. Yeah. But then when game day came back around and I started learning about the benefits for guys as they get older, it's not about being a bodybuilder. It's about having a better sense of wellness. And there are so many things that it spoke to for me, talking about your energy, your focus, getting better sleep, and even a leaner and more muscular physique. What is it about testosterone that does that for guys? And why does this seem to be that magical ingredient that every guy probably over the age of 30 needs to at least look into?
Yeah, as we get older, unfortunately, we start to deplete our testosterone production. Mm-hmm. So it makes it significantly harder to act as a male the way that you were in your 20s when you were in college or in your late teens. It's hard to put on muscle, and it's hard to lose weight as well.
Right.
So people have the misconception, oh, testosterone, that's steroids, and you're only doing it to gain muscle mass.
Right.
But it's not that.
Yeah. That's why I really wanted to have this conversation, because I had that fallacy as well. And I knew it was effective for putting on the muscle.
Yeah.
And it was, and it is. And you know what's interesting, too, is all these attributes that I was looking to get, I got. Clearing out the brain fog, better energy. But I also noticed, too, I got a little bit stronger because I had been doing push-ups and pull-ups. I'm like, all right, I'm kind of doing this with ease that I haven't had in quite some time.
Yeah.
So it does have a noticeable difference.
It has significant benefits as well for cardiovascular, right? For the heart.
Yeah,
it also strengthens your bones. People forget if you have low testosterone, it weakens your bones over time. That's why this is not just for guys in their 30s and 40s and 50s. It's important for the elderly as well to make sure their testosterone strength as well, so they don't fall into this like osteoporotic low bone strength situation due to chronic low testosterone levels over the years.
Now, what stood out to me was just guys over the age of 30, a quarter of all men are going to have low testosterone. I saw a stat the other day, if it's true, it is said that starting at about the age of 30 for guys, every single year you lose about 1% of your testosterone. And it just keeps depleting year after year.
It's true. It's true. I do recommend that, everyone's getting their primary care visits and they're doing the usual traditional labs that are done. But testosterone, what most males don't realize is that's not part of your annual screening as a male.
Right.
And so when you go to your primary care, they're not really checking for it unless you're mentioning these symptoms, which a lot of guys, honestly, they don't. They're worried about their blood pressure and cholesterol when you get to this age. They're not worried about their testosterone so much, but they're not aware of it. And primary care physicians usually aren't checking because they're not part of the screening guidelines. So that's why we recommend, come on into game day, get it checked out.
How do they feel about it, though, when you're talking about primary care physicians? Because I've heard some demonization about hormone replacement therapy causing prostate cancer. And that's why you can't touch this stuff because you're going to elevate that. Now, is there truth to that? Is there concern with that? Are there certain people that shouldn't even come close to hormone replacement therapy because maybe they have prostate cancer in their family?
That's a great question. I'm a medical oncologist. I treat cancer. My focus is in prostate cancer.
Okay.
I do significant lectures all over the country about this. And hormone replacement therapy does not cause prostate cancer. There are many studies that have verified that over the past couple of decades. But if you have underlying prostate cancer that hasn't shown itself, it could probably precipitate it. Okay. Having said that, it's not the cause of the prostate cancer. It'll just bring awareness to it. But I have many prostate cancer patients that have come to me for treatment. We've cured them. They've finished treatment, and then they're under this misconception that, oh, you can't touch testosterone because it'll bring back my cancer. That is not true. That is not true at all. And so we do it very effectively, very personalized for these patients so that they can safely after they're cured, get back on testosterone-based therapy.
Let me talk a little bit about GameDay Men's Health and the credibility that you guys have, because I've been to 2 other places to do my hormone replacement therapy before I found GameDay Men's Health. I think one of them was a foot doctor and the other was a gynecologist. And I was so impressed with GameDay because I said, so there's a place that only does this. And that's what GameDay does. The specialization to me has been very impressive. The expertise of everybody there, and what blew me away, and the biggest thing I love most about GameDay Men's Health was going in and getting your lab work done there, because the other 2 places I've been, I had to go to Quest Diagnostic or another place. The cost was pretty significant to the point where I dreaded testing, which is not the way you should be, because you got to keep your levels right. And those things can really fluctuate. Tell me the importance of balancing your levels and continually testing, and what does set GameDay apart from the other places, for instance, that I went and other guys are going as well, because so many people are doing this. It's, to me, amazing and bizarre just how many people that are not specialized in hormones can actually go on ahead and dole out testosterone.
Yeah, at GameDay, we focus on personalized men's health. This is about coming on in, getting an individualized and personalized treatment plan, and we construct labs for that person or client or patient tailored to them. And based on the large panel that we do, we find out what is deficient. And then we create a personal plan for that person. This is not some puppy mill shop where everyone gets the same thing. This is tailored to exactly what's wrong with you. You don't have to go. This isn't, testosterone isn't like 10 years ago or 20 years ago where you had to find someone in the back of the gym or be in a certain situation.
And they would give you all the same thing.
Yeah, they give you all the same thing, and you'd hope it'd be right, and then you'd have you can really hurt yourself if you're not carefully monitoring these situations and these medications. But we not only do we personalize it for you, we also keep track while you're on therapy to make sure that this is working. We're proving it to you, and then also adding in several other things like peptides if you need them. We use testosterone-based therapy.
What is a peptide? Just for anybody who doesn't know.
Yeah, so these are like natural, different types of hormonal agents that essentially help, whether it's amino acid based or not. They help. From recovery to muscle strength to anti-aging to better skin. There are so many different peptides out there that really help, and we have them at GameDay that help overall health.
And you would just, in a sense, add that to whatever the cocktail is that you've created. And it's all in there, and you take it at one time.
It's based on clinical symptoms and lab values, and we would say, hey, I'd recommend this. Of course, there's no pressure, but I'd recommend this for you because you're having some deficiencies in this or that, and it significantly helps people. I mean, that's what Hollywood's doing. That's what all celebrities are doing. Athletes are doing. It's not just testosterone-based therapy. They're on peptides as well.
Now, there are different types of testosterone, correct? Like different, not necessarily brands, but you have, I remember one was like Dayball or something like that, and they have different names. Now, do you prescribe out all the different varieties, or do you stick with one that you find to be most effective for what we're talking about, rejuvenation?
Yes, so those are more like anabolic steroids that were utilized. We use testosterone cypionate, and so we're using one type of testosterone. That's really.
And why is that? For people that know about the other anabolic steroids that are out there and know those names, because in my weightlifting days, I always heard everybody talking about all the different brands. Right. So why the cypionate, and why is that the only one that GameDay uses?
That's the one that is recommended by the FDA. That's when if you have low hypoaldosteronism and you see a urologist, that's the ones they'll utilize. And that's what we feel is recommended to help improve a patient's symptoms if they have low testosterone. And it's cleaner. It's approved by the FDA. It's monitored. So.
Okay. Now we're talking about amazing benefits here: increased energy, better focus, clearing out the brain fog. We talked a bit about the physique. Why is it that it lends to better sleep? Because I have noticed, boy, it has become, I need now at my age, I need a sleep aid. I need something to kind of help get me there so I can get a solid night of sleep. And that is so important to talk about your brain health. And you really got to clear out those cobwebs and get into that deeper sleep. What is it that testosterone does that contributes to better sleep?
Well, believe it or not, testosterone is regulated by the pituitary gland in your brain.
Okay.
And so, of course, with your adrenal glands, and they work hand in hand together.
Okay.
But that is why when you have low T, that whole entire system is abnormal. And so when you regulate it and improve it, then you're finally getting the entire machine work or mechanism to improve. So that's why it doesn't surprise me that your sleep is better. Doesn't surprise me if your fatigue has improved. Doesn't surprise me if you notice you're getting either leaner or stronger or having more energy, because you're actually like the epicenter is completely improving by improving your testosterone levels.
And would you say that it's fair that when you get on the hormone replacement therapy, it's like optimizing your body, kind of getting everything into alignment? Because it does take sleep, it takes the right diet, takes a little bit of exercise, and then this just seems to be a component of all those other things, putting them in line so that you can optimize yourself.
Absolutely. Not only does it do that, it also improves overall function and health for yourself, as you mentioned. In an overall perspective. And it happens pretty quickly. I mean, you'll notice changes, if not in a few days, in a week or two. So it's not one of those things that takes several months to lead into to see any improvements.
So if I'm listening right now and I'm saying, well, I got fatigue, I'm putting on some weight, I don't seem to be motivated, how do you know if it's actually hormonal? Because I'm sure there's other things that can cause those things. So you just have to come in and get your labs done to see if it is actually hormonal, and that's how you know the difference?
Yeah, come on in and get your labs done. Those symptoms are by far, as a clinician, the most common symptoms of every patient.
Okay.
And so by far, you have to come in, get your blood work done. Let's evaluate. Let's do a clinical exam and see if this is going to help you.
I can tell you with my process, and I'd be curious if mine is the same as everybody else's. I went in and I was in very quickly. I don't give blood well.
Yeah.
My veins shrink. They just do not want to give up blood. And I could not believe how great Kyle was. It took my blood. It was over and I didn't know he had started. And he's like, I couldn't. It was stunning. And I've heard, I don't know if I was being messed with, but they said that when you get somebody at GameDay, they are going to be drawing the person who owns the clinic's blood. And it's basically a pass-fail. If you make my arm black and blue, GameDay's not for you. Is there any kind of truth to that? Because Kyle was absolutely amazing. I was impressed with the expertise from him.
You know, it's like any other specialty. There are nuances to drawing blood, what type of needle you use. We've optimized those things. Even the type of needle matters.
Yeah.
Even the size of the needle
absolutely.
matters.
Right.
And we've made sure that we've optimized that. We haven't skimped on, those types of costs in respect to the clients or patients. We make sure we have top-notch equipment, top-notch needles when we're drawing blood so that patients can have the best experience when they're going through that. And that's just a clear example right there.
My blood was done. Labs, I think, came back at about 15 minutes or something like that. It didn't seem like it's very long. And then I had what I needed to start the treatment exactly that day. Now, was this because I'm Kevin and I'm awesome? Or is this what other people can expect out of their experience to GameDay as well?
Yeah, they would have the same experience if they went to a GameDay. I'll tell you, in my clinic that I work at as an oncologist, I cannot get those labs same day in that quick of a time. As a physician treating cancer patients.
I was stunned by the turnaround.
Yeah, it's pretty amazing, and they have the latest technology. So without a doubt, anyone that walks into GameDay is going to have the same experience.
Tell me a little bit about what the cost, because I'm sure somebody right now is saying, okay, yeah, of course you want to feel better. You want to get rid of the brain fog. You want to have more energy. You want to sleep better physique, all that kind of stuff. What is it like? What are you having to expect to have to pay, and how do you offset that with the other costs that you have in life? What do people say when they come in and see what it costs to get on these treatments?
Well, first and foremost, come on in and get the blood work. You got nothing to lose. And from a cost perspective, it's nominal, right? Okay. And we create an individualized plan that's tailored for you. These things can get expensive, especially now with this somewhat recession we got going on and higher inflation and higher costs of living. So we can tailor it exactly to you, but we make sure we make it where it's affordable. Our most important thing is that we make sure that the patients have a good experience and they do well. And if they do well, remember, there's a reason why people say your health comes first. And it's true. I mean, we put so much strain on our bodies and we neglect ourselves so much. And if we live in a state of inflammation, which is exactly what you're doing when your testosterone is low.
Okay.
If you're living in a state of inflammation, you're going to have problems later on down the road.
Right. It all adds up. It's like the bill's going to be due.
Yeah, exactly.
So you're investing in your future.
100%.
That makes a lot of sense. How long before you start feeling this? Because if you can come in for same-day testing treatment, I got my treatment quick. Now, the one thing that I do have to admit was I was lifting weights, and it felt like it was the next day I was lifting more weight, but I wasn't lifting weight when I did this. And I was going to say, it was probably about day 8. I was like, okay, am I really feeling anything? I don't know. And then day 8, I was like, I felt really awake. I felt good. I was like, I probably got a good night of sleep. Day 9, I felt great. Day 10, I felt great. And then it's been every single day. I don't know that I've had a rundown day since I started doing this. Is that common that it might take about 8 to 10 days before you really kind of start feeling it? Is what you feel similar to what I felt? Is that the right path?
Without a doubt, this is one of those things that you can see it as soon as 2 to 3 days.
Okay.
And for some people it might take 3 to 4 weeks.
Okay.
It really depends on what your levels are from a testosterone perspective are, and how quickly you improve with your injections. And so everyone's curve is different, and there's a curve that we look at in regards to how quick you produce testosterone when you are given the injection. But I'm telling you, this is not one of those things that takes several months to see the improvement.
Right.
And then once you start it and you see that how much improvement and how run down you've been letting yourself get without it, you're like, oh, I'm never getting off. As long as I'm safely doing this, which GameDay prides itself on. And that's our biggest differentiator, is making sure our clients are safe and that this is personalized towards them. And this is not some puppy mill scenario where you just get your testosterone and we never see you again. That's not what we're about. We're about improving men's health and improving our clients, making sure they do really well while on treatment.
Do you look at anything other than just a testosterone level on the labs that you get back? Okay.
I'll give you an example. The other day, we were able to capture a brain tumor. Now, let me tell you what I mean by that. Yeah, so we look at prolactin levels.
Yeah.
And if you're and this should be normal. Again, another hormone that we look at in regards to that is involved with the pituitary gland in the brain, right?
Yeah.
So we look at prolactin levels, and this client's prolactin level was significantly elevated. We're like, hey, that's not right. You got to get scanned. This is not right.
Wow.
Let us know. Let's get you scanned. And we actually found what we call a prolactinoma, a brain tumor for this person.
Wow.
And now they're getting treated and they're doing really, really well. So yes, we look at testosterone, but that's not all we're looking at. Our tests are incorporating many different things and scenarios to make sure you're doing it in a healthy manner.
So in a sense, it's kind of ultimate wellness then.
Oh, without a doubt. And I think that's what everyone's looking for. They're not looking for the traditional, just my cholesterol, and which we do check, by the way. They're not just looking for traditional, just check my cholesterol and see if I'm a diabetic anymore. I think they want wellness, functional medicine, and making sure their hormone levels are optimized.
Do you see a lot of guys waiting until they completely crash out and they just can barely make it through their day before they come in?
Yeah. As a dad myself in his 40s, I think men are known to neglect themselves until the very last, the end where they can't take it anymore.
Yeah. To me, just the fact that you guys offer the free labs, I don't want to tell everybody to take advantage of you, but in a sense, take advantage of you, because I mean, that really is something. Some of the places I priced out, $300 to $400 was the last I saw pricing wise going to get some labs done. To be able to get that for free, to at least be able to look at your health and to know and say, hey, if you are low in testosterone and this would be a great treatment for you, you can get how much that would cost and say, okay, prioritizing my health, how much is my health worth to me? And you can kind of lay that out. That's how I would feel about it.
Absolutely. You got nothing to lose. Come on in, get free blood work done on initial assessment, see where your levels are, and then you make a judgment call whether it works for you or not.
So what you need to do, there are great locations all over South Florida. Now, you deal with West Palm Beach, Wellington, and Delray.
That's correct.
But there's Palm Beach Gardens, there's Boca, there's West and Aventura, Miami Lakes, so many places to go. You can go to GameDayMen'sHealth.com and you can go on ahead and find the clinic that is closest to you. Go on ahead and book that consultation, get in there, get your lab work done. Mention my name, Kevin from the KBJ Show. They'll give you $400 worth of premium vitamins and also do some shockwave therapy on you as well. GameDay Men's Health is how you started. Dr. Taha, thank you so much for coming in and talking about this today.
And thanks for having me.